Welcome into the live desk on this Tuesday. My name is Janae Hancock. Today we are going to be talking about health within our community and across the nation. And I do want to let you all know that norovirus cases, they are surging across the country right now. But what is it exactly and who has it impacted the most here locally? With that being said, I do want to bring in our guest for today. You are taking a look at Dr. Matt Shoemaker, who joins us here now. There he is. Welcome, Dr. Shoemaker. Thank you so much for joining me here at the live desk. So we are talking about a very highly contagious virus. Is that correct?
Yes, norovirus is very contagious. Less than 100 viral particles can get somebody sick.
And tell us a little bit more about what norovirus is, because I know a lot of people, this may be their first time hearing about it. It doesn't come up all that often in the past few years, at least.
No, it doesn't come up all that often, but a lot of people have been exposed to it, even if they don't know. This is the, common term is the stomach flu. It's a gastrointestinal illness that can last 1 to 2 days, mostly nausea, vomiting, diarrhea, self-limited, meaning it goes away on its own. The biggest risk, though, is in vulnerable populations, dehydration.
And I know the CDC, they just issued a warning just a few days ago, but are we seeing a rise in cases here locally? I know we're seeing some across the country right now.
Yeah, the Midwest is seeing cases. We have seen some locally here in the Kansas City area, both related to food and beverage establishments as well as elementary schools. Although we are not as high as the rates in the northeastern United States or the western United States, our levels are going up as well.
And I know you touched on elementary schools. Are we seeing that the children are most impacted, or is it the elderly as well? Who should really be on watch?
I think, those that get the most severely ill are the very little infants and small children and the elderly. But bringing up elementary schools, this thing can spread through congregate settings like that very quickly, especially in areas where hand hygiene may not be optimal. And any of us that are parents know that, sometimes school-age kids are not the best at washing their hands.
And let's really talk about those symptoms. Are they related to maybe COVID symptoms? There are so many different viruses that are going around just within the last few years. So what should we really be looking out for within ourselves and also within our children and those we love the most?
As far as norovirus goes, it would be kind of a very sudden onset, nausea, vomiting, and diarrhea. That's going to be really the only symptoms. You may have some fevers or chills or some stomach cramps, but no respiratory symptoms at all with this.
And I know you said as far as it is really considered kind of like a stomach bug, and I've heard like vomiting as well as other things, just kind of being in the bathroom for a very long time. But what can people do right now to stay healthy to make sure that they do not get this highly contagious virus?
I mean, the biggest way is very good hand hygiene, washing your hands frequently and adequately. For restaurants, it's keenly important to ensure that people that run restaurants or the food establishments make sure that people who are sick do not come to work because that's where we see some outbreaks starting.
And you mentioned as far as food, so it's really important for people who are planning maybe their spring break trips to really keep this in mind, that this is another virus that they need to be aware of.
Absolutely. I don't think I would change my plans over this, but just be cognizant of it. And again, make sure that you're having good hand hygiene. You don't have a lot of control over the folks that work in the back of the establishment, but you hope that the ownership and leaders there will keep their ill people at home.
And for the viewers who are just now joining us, we are seeing a large increase, a rise in norovirus cases across the country right now. We're also seeing some here locally. This is Dr. Shoemaker. Do you have any other advice for our viewers before I let you go here today?
Just wash your hands a lot and get your flu shot and your COVID shot.
Perfect. Dr. Shoemaker, as always, I want to thank you so much for joining me here at the live desk. We will continue to follow this developing story regarding an increase in norovirus cases across the U.S., but especially here locally, as many people plan to travel looking ahead to spring break.